Welcome to Data's Medics channel. Today I want to discuss with you osteoarthritis. Osteoarthritis is a leading cause of joint pain, back pain, and all the pains you really present in the hospital. There is no day in my practice that I don't see patients presenting with complaint of joint pain and back pain. Now, what is osteoarthritis? I want to discuss the anatomy of a normal bone. We have several bones in the body, and where two or more bones meet, that's what we call joint. In every joint, in between those bones, there's a coating called articular cartilage, kind of protective tissue, which allow the bone to rub on each other without having to cause friction. But in osteoarthritis, due to there's a wear and tear of the articular cartilage, which gives rise to friction between the bones. And when there's friction, it triggers inflammation, and those inflammation result to pain. That's what happens in osteoarthritis. It happens in elderly, and it's commoner in women. Now, what are the symptoms? The risk factor to getting this osteoarthritis. One is age. As person age over time, prolonged use of those joints, there's this wear and tear of those articular cartilage, and result to the bone rubbing on each other and causing frictions and inflammation and pain. Another common causes, risk factor, is overweight, obesity. Obesity is simply a BMI. BMI is called body mass index. A body mass index is calculated from your weight in kilogram over height square. If you are getting a neighborhood of 30 to 40, that's obesity. And obese, once you are obese, there is a mechanical stress on the articular cartilage, which lead to wear and tear and result to osteoarthritis. So that's why most children, those that are not elderly, they are presenting with osteoarthritis, joint pain, because of their weight, obesity. Other causes of joint pain, osteoarthritis, is trauma. Trauma can cause damage to the joint pain. What are these risk factors to this osteoarthritis? One of the risk factors is age. Is linked with aging. As you age, there is wear and tear of the articular cartilage. Once there is a tear of the articular cartilage, we have this loss of this lining, causing the bone to rub on each other and resulting to friction, which eventually to inflammation and pain. Then we also have obesity. Obesity cause the articular, the wear and tear of the articular surfaces. Once they are big, there's a mechanical stress on the articular cartilage, resulting to inflammation and pain. Other risk factors is when you have trauma. So, what is the symptom? How people with osteoarthritis, how do they present? Most presentations are joint pain. You see some patients not able to walk. We have joint pain, joint stiffness. Most times when they wake up in the morning, the joint is so stiff they can't walk. Then you also have back pain. The back, there's the bone, the spine. So if it's happening, the arthritis that is happening occurring at the back is called at the lumbar region, the lower back. It's called lumbar spondylosis. So those are the common presentation pain. You also have stiffness. Then another presentation is inability to walk and all that. So the management, how do we manage this pain from osteoarthritis? It's very simple. Now, what we do at the clinic at Data's Medics, we give drug. Drug is temporary measures to only suppress the pain for a while. But a permanent cure is we subject the patient to undergo some exercise. We call it physical therapy or occupational therapy. We have a team at Data's Medics that are involved in that. So we also advise the patient to shed weight. Weight loss is another method of helping to manage the arthritis pain. Once you shed weight drastically, reduce the stress on the articular cartilage, that once the articular cartilage, there's no stress on articular cartilage, there's no wear and tear, there will be a protective between the bones. So we advise the patient to shed weight by eating right, eating normal food and balanced diet. Then we will also apply some appliances like nail support. If you are having osteoarthritis of the knee, which is of course is very common presentation in the hospital, there are things we give our patient that is managed. We give knee support. Knee support helps to put the bone in place so that there won't be a separate the bone from being coming in contact to each other. Since there's the articular cartilage has lost, so we separate the bones so that there won't be a rubbing action. So knee support is also very, very good. They will also have ankle support for those that are having arthritis of the ankle. And for lumbar spondylosis, of course, it's very common these days. We do lumbosacral support. It also helps. And our dentist medics, we have our team, medical team personnel comprises of the physiotherapy, the orthopedic doctors, and a consultant. We help you manage your pain. So if you have a prolonged pain from osteoarthritis, you are unable to walk, you can contact dentist medics and offer a fantastic help. And if this helps, you want to hear more about health, you can subscribe to our channel, Dentist Medics, where we update you on the latest happening. Thank you for listening. God bless.